Hello, my name is Kimini Contreras. I'm a student physical therapist assistant at CBD College, and this is my week 9 video submission for PTA 620. Today, I will be having a conversation with a patient who was diagnosed with peripheral vestibular hypofunction 3 days ago. So, let's talk about the vestibular system. This system helps maintain balance, coordinate eyes, head, and body movement. This system works with the visual and somatosensory system, which is responsible for how we feel and perceive sensations like touch, pain, temperature, and body positions. The vestibular system is located deep within the inner ear, and when head movement occurs deep within the ear structure, there are tiny crystals attached to tiny hair cells that also move in different directions. When the otoliths or the tiny crystals move, the message of how that movement occurred and the speed in which it occurred is sent to the brain, specifically the cerebellum. To be even more specific, the utricle senses horizontal movement left to right, and the saccule detects vertical movements like up and down. So basically, these structures would be responsible for the sensation felt when moving up and down an elevator. Another thing that makes up the vestibular system are the semicircular canals, which are basically 3 loops located deep within the ear structure filled with fluid that also moves in the direction of the head movement. So this part would be responsible for sending sensory information to the brain about nodding your head yes or no or side to side, and even how fast the head movement is occurring. During peripheral vestibular dysfunction, there are delayed signals, causing patients to feel dizziness. There's a reduction, and oftentimes therapy is needed to help these individuals feel less nauseous or dizzy. Deficiencies in the vestibular system create symptoms like dizziness because these tiny crystals or the otoliths within the semicircular canals do not go back to place after movement in the head. This sends confusing messages to the brain regarding head movement and positioning, which causes dizziness and even unstable eye movement. There are many exercises that can help strengthen the vestibular system, including gaze stabilization strategies, head movement, static balance, and dynamic balance. Some of these exercises induce the sensation of dizziness for a temporary time, but in the long run, it will help reduce dizziness. These exercises will help the brain receive more accurate information from the vestibular system regarding head movement, spatial awareness, and balance. Another thing that you should know is that these exercises will make you feel dizzy for a moderate amount of time. This moderate dizziness is normal and a part of the physical therapy. But if the dizziness is not temporary and it is prolonged, it is important to vocalize to the professional clinician to have readjustment of the interventions. Thank you.